When we think of heart trouble, specifically a heart attack, our minds almost immediately go to the Hollywood depiction. A man suddenly clutches his chest in agonizing pain and collapses to the floor. While this certainly happens, it represents only one version of the event. For individuals over the age of 60, heart disease often presents itself not with a scream, but with a whisper. This phenomenon is clinically known as silent ischemia or a silent myocardial infarction. Medical data suggests that nearly 45% of all heart attacks are silent, meaning the traditional chest pain is either absent, very mild, or attributed to something else entirely. As we age, the body's alarm systems change. The nerves that transmit pain signals from the heart can become less sensitive due to aging or conditions like diabetes. Consequently, the heart may be struggling for oxygen, tissue may be dying, and yet the brain never receives the signal of pain. Instead, the body manifests this distress through subtle, systemic changes that are easy to ignore or dismiss as simply getting older. The most pervasive and frequently ignored silent sign is unusual, debilitating fatigue. We are not talking about the normal tiredness one feels after a long day of gardening or playing with grandchildren. This is a profound, unexplained exhaustion that does not improve with sleep. It is the sensation of having your batteries drained. Physiologically, this happens because the heart cannot pump enough blood to meet the body's needs. When cardiac output drops, the body enters a preservation mode. It prioritizes blood flow to vital organs like the brain and kidneys, shunting it away from muscles. This leaves the limbs feeling heavy and the person feeling lethargic. If you find that an activity you could easily do 6 months ago, like walking up a flight of stairs or carrying groceries, now leaves you needing to sit down and rest for 20 minutes, this is a red flag. It indicates that the heart muscle is unable to keep up with minor physical demands, a classic sign of heart failure or coronary artery blockage. Another silent symptom that masquerades as a minor annoyance is digestive distress. Many seniors mistake heart trouble for heartburn, acid reflux, or general indigestion. This confusion occurs because of the shared nerve pathways between the heart and the stomach. The vagus nerve acts as a superhighway for signals from the abdomen and the chest. When the heart is inflamed or struggling due to a lack of oxygen, specifically in the inferior wall, the bottom part of the heart, the pain signals can get crossed in the spinal cord. The brain interprets this distress signal as coming from the stomach. This often manifests as a burning sensation in the upper abdomen, nausea, or even vomiting. If you are over 60 and experience a sudden onset of indigestion that is not related to a spicy meal, especially if it is accompanied by a cold sweat or lightheadedness, it is crucial not to dismiss it as a simple upset stomach. Antacids will not fix a cardiac event, and waiting for them to work can cost valuable time. Closely related to this, referred pain is discomfort in the jaw, neck, or upper back. The heart lacks the ability to feel pain directly like the skin does. When heart tissue is damaged, it sends pain signals to the spinal cord, where they converge with nerves coming from the jaw, the left shoulder, and the neck. This phenomenon is particularly common in women over 60 who are statistically less likely to experience crushing chest pain than men. A dull ache in the jaw, a feeling of tightness in the throat, or pain radiating between the shoulder blades can be the only sign of a blockage. Because these areas seem so disconnected from the heart, many people visit a dentist or a chiropractor unaware that the root cause is cardiovascular. If physical movement or exertion makes this jaw or back pain worse, and rest makes it better, it is almost certainly cardiac in nature. Breathing patterns also change silently when the heart is in trouble. This is not always the gasping for air associated with a sprint. It can be much more subtle. One specific sign to watch for is orthopnea, which is shortness of breath that occurs when lying flat. If you find that you need to prop yourself up with 2 or 3 pillows to sleep comfortably, or if you wake up in the middle of the night gasping for air, a condition known as paroxysmal nocturnal dyspnea, your heart may be failing to pump blood effectively. When you lie flat, gravity no longer keeps fluid in your legs. That fluid redistributes to your core. If the heart is weak, it cannot handle this increased volume, and the fluid backs up into the lungs, essentially drowning the air sacs. This is a primary sign of congestive heart failure, CHF, a condition that becomes increasingly common after age 60. This leads us to the physical sign of edema, or swelling. As the heart weakens, it loses the ability to pump blood efficiently against gravity. Blood begins to pool in the lowest parts of the body, usually the feet, ankles, and legs. This is often dismissed by seniors as a result of sitting too long or consuming too much salt. However, cardiac edema has specific characteristics. It is usually bilateral, occurring in both legs, and tends to get worse as the day progresses. A simple check is the pitting test. If you press your thumb into the swollen area on your shin or ankle, and the indentation remains for a few seconds after you remove your thumb, this is pitting edema. It suggests fluid retention caused by the heart's inability to cycle blood back up from the lower extremities. While kidney issues can also cause this, in the over 60 demographic, the heart is a primary suspect. A less discussed but highly significant silent sign involves cognitive function. We often separate the heart and the brain, but they are inextricably linked. The brain is a voracious consumer of oxygen, requiring about 20% of the body's total supply. If the heart's pumping ability is compromised simply due to an arrhythmia like atrial fibrillation or a weakened vessel, the brain is the first to suffer from hypoperfusion or low blood flow. In seniors, this might not look like a heart problem. It looks like sudden confusion, memory lapses, dizziness, or a feeling of brain fog. Family members often mistake this for the early stages of dementia or just aging. However, if confusion comes on suddenly, or if a person seems disoriented and lethargic, it may be because the brain is not receiving enough oxygenated blood. Correcting the heart issue, whether through a pacemaker for a slow heart rate or medication for a blockage, can often reverse these cognitive symptoms completely. It is also vital to discuss the role of diabetes in silencing heart symptoms. A significant portion of the population over 60 is either diabetic or pre-diabetic. High blood sugar over time causes distinct damage to the nerves, a condition called neuropathy. This neuropathy doesn't just affect the feet, it affects the autonomic nerves that serve the heart. A diabetic patient may have a massive heart attack and feel absolutely zero pain because the nerves responsible for sending the pain signal are dead or damaged. For this demographic, the silent signs, shortness of breath, sweating, and nausea are often the only signs. Therefore, if you are over 60 and have diabetes, your vigilance regarding these non-pain symptoms must be significantly higher than the average person. Finally, we must address the concept of exercise intolerance as a diagnostic tool. Many people over 60 gradually reduce their activity levels, unknowingly masking heart symptoms. If you never push your heart, you never trigger the warning signs. This is why the silent heart attack often strikes when a usually sedentary person suddenly exerts themselves shoveling snow, rushing to catch a bus, or lifting heavy luggage. The blockage was there all along, but the demand never exceeded the supply until that moment. A proactive approach involves monitoring your response to moderate activity. If you could walk a mile comfortably last year, but now have to stop halfway due to leg heaviness or breathlessness, your body is speaking to you. The key takeaway is that after age 60, you cannot wait for the dramatic, movie-style symptoms to seek help. The body compensates, adapts, and whispers before it screams. The presence of unexplained fatigue, digestive issues, jaw pain, swelling, or confusion warrants a medical investigation. Diagnostic tools like a simple ECG, a blood test for troponin levels, or a stress test can uncover these silent issues before they become catastrophic. Identifying these silent signs is not about living in fear. It is about having the high-definition awareness required to maintain your health and longevity. By listening to the subtle signals, you can catch heart disease in its whispering phase, which is when it is most treatable.